representing Nanaimo, which has been hit early and hit hard by the opioid crisis. 150 deaths in the last 5 years. Overdose rates 50% higher than the rest of BC last year. Firefighters, Chad Porter just told me this morning, they're on track to be called out just in Nanaimo alone to 500 overdoses just in our city of 100,000 people. It's colossal. So given that the Liberals called this debate tonight, we really wanted to hear more oomph, more new, like what is the new offer that we have to families that are hit so hard. I want to read a bit of a letter that was sent to me by Tina McKenzie. She actually wrote it to the Prime Minister. Copied me. She says, my close friend lost her daughter, a young mother just 25 years old, 3 weeks shy of her only son's 4th birthday. Yes, her mother tried to seek help for her daughter many times turned away as a waiting list grew. You cannot place an addict on a waiting list for help. It almost appears these human beings are put on a waiting list to die instead. She says, Justin, where are the changes? I've read the federal government action plan. All I read is observers collecting information and no real action plan. Please stop talking and start doing. My question to the government, when are you going to start doing more to treat this emergency in the way that the victims and the families deserve?
Parliamentary Secretary.
Thank you, Mr. Speaker, and I'd like to thank my friend for that question and those comments. And obviously, she too is sharing some very personal experiences of her constituents and her friends and perhaps even neighbors. And then I did that in my opening remarks, Mr. Speaker. Yes, it is a crisis. It is absolutely a crisis, and I outlined a number of very important initiatives the government's undertaking. But I think it's critical to also look at the research, the underlying research that needs to inform us in terms of what the next steps are. And that's what the government is also doing. So while we're putting in measures that do address the immediate need, but I think we're also looking at a longer-term undertaking to ensure that our decisions are based on sound science, one that is directed by the evidence that's before us, one that brings together and collaborates with researchers, with individuals, with patients, with families, with policymakers. And I think that's critical to any sound decision that a government could move forward with.